This medication is prescribed to patients with a specific type of lung cancer called non-small cell lung cancer, NSCLC. Augtyro 40 mg Capsule Antineoplastic, Protein-Tyrosine Kinase Inhibitors works by slowing down or halting the growth of cancer cells. It falls under the category of drugs known as kinase inhibitors. Patients taking this medication may experience benefits such as reduced tumor size and improved overall health. The recommended daily dosage is determined by a healthcare professional based on the individual's condition. It is important to take this medication at the same time each day for optimal effectiveness. Before taking Augtyro 40 mg Capsule Antineoplastic, Protein-Tyrosine Kinase Inhibitors, make sure to read the patient information leaflet from your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually twice a day. Your doctor may start you on once a day and then increase to twice a day to reduce the risk of side effects. Swallow the capsules whole and do not open, crush, chew, or dissolve them. The dosage will be based on your medical condition and response to treatment. Take this medication regularly at the same times each day to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it is safe to do so. If you vomit your dose, do not take another one. Just take your next dose at the regular scheduled time and do not take 2 doses at the same time. It is important to note that since this drug can be absorbed through the skin and lungs and may harm an unborn baby, women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the capsules. Some common side effects of Augtyro 40 mg Capsule Antineoplastic, Protein-Tyrosine Kinase Inhibitors may include dizziness, tiredness, sleep problems, constipation, nausea, or changes in taste. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist right away. It's important to note that people using this medication may experience serious side effects, but your doctor has prescribed this drug because they believe that the benefits outweigh the risks. Your doctor will monitor you closely to minimize any potential risks. Be sure to contact your doctor immediately if you experience any serious side effects, such as mental/mood changes, unsteadiness, numbness/tingling of arms/legs, new or worsening lung problems, signs of liver disease, muscle pain/tenderness/weakness, signs of high uric acid level in the blood, bone pain, or changes in movement. Additionally, this medication may increase your risk for bone fractures, with or without a fall or injury. If you experience bone pain or changes in movement, it's important to notify your doctor right away. It's also important to be aware that this medication can decrease bone marrow function, leading to a low number of blood cells. This can cause anemia, decrease your body's ability to fight infection, or cause easy bruising/bleeding. If you develop symptoms such as unusual tiredness, pale skin, signs of infection, or easy bruising/bleeding, contact your doctor immediately. While a serious allergic reaction to this drug is rare, seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you experience any other effects not listed. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA. If you are in Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada. Before taking Augtyro 40 mg capsule, make sure to inform your doctor or pharmacist if you have any allergies or if you have a history of liver or kidney disease. This medication may cause dizziness, drowsiness, or blurred vision, especially when combined with alcohol or marijuana. It's important to avoid driving or operating machinery until you know how this medication affects you. If you are pregnant, planning to become pregnant, or breastfeeding, talk to your doctor before using this medication. Women should use reliable non-hormonal birth control while taking this medication and for 2 months after the last dose, while men should use reliable birth control for 4 months after the last dose. If you have any concerns about the risks and benefits of using this medication, be sure to discuss them with your doctor. It's important to be aware of any potential interactions with other medications that may affect how Augtyro 40 mg capsule works. This medication may affect the removal of other drugs from your body, which can impact how they work. For example, it may decrease the effectiveness of hormonal birth control such as pills, patch, or ring, leading to a potential risk of pregnancy. It's important to discuss with your doctor or pharmacist if you should use reliable backup birth control methods while taking Augtyro 40 mg capsule. Additionally, it's important to keep a list of all the products you use and share it with your doctor and pharmacist, and to not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure that Augtyro 40 mg capsule works effectively and safely for you. If someone has taken too much Augtyro 40 mg capsule and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important not to share this medication with others. Before starting this medication, it's important to have lab and/or medical tests, such as liver function and uric acid level. It's also important to keep all medical and lab appointments while taking this medication. If you forget to take a dose, just wait until the next scheduled dose. Don't take extra to make up for the missed dose. It's important to store Augtyro 40 mg capsule antineoplastic, Protein-Tyrosine Kinase Inhibitors at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it comes to getting rid of this medication, don't flush it down the toilet or pour it into a drain unless you're told to do so. Instead, properly discard the product when it expires or is no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.